the test of the material. They do it at the door. They are not entering the dressing rooms of the players. So really, it's different than it was before, but it's possible to do it like this. And may I have the next slide, please? What I said, the matches, no audience, and no escort kids, no mascots. With the ball boys, at least, we don't have nearly none ball boys anymore. We put the balls around the pitch side, and we have 2 ball boys who really put the balls everywhere so that the players can grab them themselves. In the technical zone, the pitch side, it's also that if you look at the coach benches, it's also there that people have to sit in a distance of 1.5 or 2 meters, so nearly every second seat is free. And so normally we only have about 6 people on the coach bench, and we are sitting because we have enough space now in the stadiums. The substitute players, for example, are seated in the stands. I can show you the picture, which in the distance, which is we call the technical zone, which is just behind the coach benches, which is quite easy. Of course, in the halftime, the teams leave not at the same time. The media is done with the distance, and we all have no press conference anymore, only a virtual press conference. And one point is also, of course, doping controls are conducted now too, but for the doping control, it is that we need 2 rooms now. We need a big waiting room where the 2 players can sit in a large distance. And we have a control room with, of course, and we have a special regulation for the doping control officers how to conduct the doping control under COVID-19. So it's all regulated. May I have the next slide, please? So what you need is, I come to the end now of the speech. What you have to do, very, very important, is education of the players and education of everybody who is there. You need to have to reduce the length of stay in the cabin. So after the match, the people are not, it's really amazing if you see it now. After 15 minutes, normally no one is in the stadium anymore. And it's also the same with the showering, because also this is a risk. If the players shower together, it might be a risk because the drop infection might be one of the common ways to get infected. So we advise the players not to shower at the same time, or shower at home, or shower in the hotel. What I said, you need to have a good organization of the security, that you have the accreditation for the zones, and everybody entering the stadium is checked again. And what I said at the beginning, what the players have to do when they enter the training garage, they have to write down that they have no infections. It is the same for everyone entering the stadium, that they have a questionnaire. So every journalist, every doping control officer, every security, they have to sign. They have no symptoms. They have to sign it. They have to leave their address and contact address. And everybody is measured the temperature. It must be below 38 degrees. Otherwise, if one of the questions we ask them in the questionnaire is not clear, he's not allowed to enter. And of course, what I said at the beginning is we test all the players and try to identify as soon as possible if we have a positive case. And we have to call it to the local authorities, and it's their decision who is getting in isolation. And that's why we have to keep the distance all the time as possible. Next slide, please. The personal requirements are not that much. It's more, normally you have less people necessary under the COVID-19 than without the COVID-19. So what you need is a hygiene officer. You need to increase the cleaning staff maybe, because all the rooms should be cleaned several times a day. Security, what I said, but only a few security people are necessary because we have no audience. The room requirements, this might be a problem. What I said in the stadium, also in the training grounds, you need really big rooms, or you need to divide the dressing rooms, or you have to, time separation that the players are not training at the same time. Material requirements, of course, this is also very easy. You need disposable gloves, face masks, and disinfections a lot. Every door, every room, the people have to be reminded to disinfect their hands. Next slide, please. May I have the next slide, please? This is nearly the end. The importance is, of course, what I always said, because the football is shown on TV, and we have to teach our players how to behave, that they are not spitting or whatever on the pitch, what they used to do, and even if they make a goal, that they are not kissing and hugging and everything, because it's on TV, and the behavior of the team is very important for the acceptance of our regulations and the restart of the league, because very, very important that because it's all about trust and confidence in the concept. And if the normal people and the streets, they have a lot of regulations, and everybody teach them how to behave, and then they see it on TV that the players are not following these regulations, it is directly against. A lot of people say we are not restarting this. Why these players are allowed to spit? Why these players are allowed to kiss each other? And so it's very important really to talk to the players and tell them how to behave. So that is the end of my speech. Thank you very much. I hope it was not too long. I have no idea. Murat, I can't hear you.
It was fantastic. Thank you so much, Jans. And really, it was brilliant, and we learned a lot today with you. And now I can say that we go for the second conference. It will be with Marcio Tanuri. Marcio, he's the chief of the medical department of Flamengo Football Club Brazil. So, Marcio, please go ahead.
Hello. You have my presentation, right?
Yes, of course.
Okay. So, first of all, it's a pleasure to me to be here. As Dr. Jen said, I think it's the first medical conference after the COVID, after the Corona, and I'm very happy to be discussing these issues, and because everybody's trying to discuss about it. And I'm going to talk a little bit about our experience and the physical and psychological assessment methods in professional football after this break. So here in Brazil, next please. So here in Brazil, we have a very different scenario, because here in Brazil we are having big issues with the Corona. At the same time, Brazil is a very large country, and we are having different scenarios in the different states, and this is another issue for us here in Brazil. Next slide, please.
Muhammad Said, please, next slide. Dr. Muhammad Said.
It's a new thing for everybody, I guess, here. And at the same time, we have a lot of papers already and telling us how to do this and how to do the right return and how we should make it. But we are doing it right now. So I don't know how we have a lot of experts, and a lot of papers and studies about it. So, and we are just creating it. So for me, for instance, it was very, very important, the experience about Dr. Jens. So here, next slide, please. As I was saying, we have some teams in different states that are training. So, but in other states, teams are not training at all. We didn't come back to the games yet, and then here in Brazil we have state tournaments, and then we need to finish the state tournaments before, and then we will start the national tournament. And we have a challenge here about it because, as I told you before, we have different scenarios in the different states. Flamengo, we stayed about 72 days in quarantine at home, and we are practicing. So tomorrow we finish our third week of training. So we are planning to come back our tournament in the end of June, beginning of July maximum, but we are planning to come back in June. So now everybody is discussing about the new normal, and this creates a big psychological impact because when the players came back to the training facilities, this is the scenario that they found. So it's the new normal, but for them it's not normal at all. And one of the problems that we check here, next slide please, it was about information. So a lot of people didn't have the information at all, even like doctors here in Brazil and the population, so even the players. So the first thing, it was to give information to them. So even before we came back to the training 3 weeks ago, we started to have webinars with the players and discuss with them about the issue, the corona, and the health impact, and so about our plans, about what was going on in the world. So you know that all the players, they talk with each other, so they know players that they have played all around the world, so they know a lot of players, so they were like watching and seeing what was going on in the world, so we was always like discussing about it. And then they were training, doing training session at home, but the intensity is completely different, so but we stimulate them to stay at home, but keep moving. Next slide, please. Next slide, please. And one of our targets, one of the problems, so we just saw when they returned in the Bundesliga, and we know that it's normal, so, but we had a lot of injuries, and we were concerned about it. So this is one of the things that we discussed, and we decided to come back to the practice to keep the movement because it's completely different from the professional player to practice in the training facility and to stay at home practicing. So for a professional player, it's completely different. For people like us, it's okay to stay at home and do something at home, but for them it was like difficult. And then we need to manage the load when you come back from the quarantine. And then here in Brazil, we have a lot of games. We have like Flamengo is going to play 5 competitions at this year. So we were afraid about it. So when the players come back in a short time before the match, so they would have like to increase a lot the intensity and the volume. And this could come with a lot of injuries. Next slide, please. So, one of the big problems of this long time of isolation is the psychological problems, and we know about it. So, first of all, even if the players were afraid about the disease, everybody was afraid. But since we start to create our webinars and discuss with them about our protocols, what we're planning to do, and how we would keep them testing, their families, and the entire staff and everybody. So they start to feel more comfortable, and it was, I don't know if it was a surprise for us, but all the players, they support us. They want to come back to practice after they felt secure about it, because we know about like the psychological problems about it, because it's difficult to stay at home for a player. We know that. So players, they keep like traveling for their life until they retire in soccer and in football. And imagine like staying 3 months at home with their family, because we didn't have schools here. The schools are closed until now. And imagine like having like the kids and like all the family, and it's a completely different environment that they used to have, that they were used to. So, and we know that the biggest impact of the quarantine, of the isolation, is a psychological impact. And everybody was afraid because of the disease, and we know about this psychological impact. So we start to create this health environment for them and for their families, so they can feel secure and safe. So next slide, please. And at the same time, so I was very happy to listen Dr. Jan, because we are watching what they are doing in German, because they were the first one to come back. And then we know that we have like a different risk in the different sports. So we know that soccer, it's a contact sports, but at the same time, we know that the contacts are very short time, period of time. So, and this creates like a very difficult environment to transmit the COVID, the virus, even if it's contact sports. But during the game, they don't have like long contacts at all. And then, as Dr. Jen said, if you are testing, and here in Flamengo, we are testing them twice a week, the same ways they're doing German. So if we know that they are free, they are negative, so we don't need to be afraid to have contact at all. Different from Europe, here in Brazil, we have a lot of players that were infected, so we start to test them actually about 15 to 20 days before we came back to the training. So we have a lot of positive tests at this time, and all of them were with no symptoms. And then now, for instance, we have like from 33 players, we have like 10 players that we have IgG positive already. So, and at the same time, that's a very good stuff. So on the beginning, when you start to test them, even before start to practice, we have a lot of positive. And then we kind of think that was very important to understand. And now we have like more than 30% of our players and our staff with IgG positive, because here in Brazil we have a lot of cases of this disease, pretty much more than Europe. So we are having more people immune at the same time too. So next slide, please. And then we were discussing with them about like giving resilience and everything, like to pass this time. Next slide, please. And then we found the other big issues. They were have like sleeping problems because for them, for the professional players, they changed their routine completely, and then they were very anxious, and a lot of players were having like sleeping problems, and because they were not practicing at all, because we know that when they practice in higher intensity in our training facilities, they get more tired on the end of the day, so they have like bad sleeping, and then we know like about the sleeping problems, and then we were having problems about losing mass, losing muscle at the same time. So that's why we work very hard to create a very health, secure place on their training facilities so we could come back to keep them healthy actually. Because for them to be active and to be there like taking care of them and their family, testing twice a week and like with all the clinical tests too, temperature and like all the questionnaires as were said before, I think it was very important for them. Next slide too. And then even when they were in quarantine, we had an app that is called Coach ID that we're using, and always they have like, as I say, a well-being questionnaire. They should like fill it on this app, so I could get it, the fitness trainers could get it, the sports science could get it, and we could check about like sleeping, anxious, depression, all of this. Next, please. Next slide. For the same time, so we know that it's very difficult to stay motivated. So we keep goals, like for instance about like weight. So they should wait even when they were on the quarantine. So we have this app on the. So they should like feel it and about RPE and other stuff like waiting just to create like some goals and to keep them motivated because we know that's difficult. Next slide, please. And then, so we are practicing for 3 weeks, but as I said here in Brazil, it's not all the teams that are practicing at all, but we are practicing for 2 weeks because we create a safe environment. And of course, always when they get there, check the signs and symptoms of COVID, and then we have like this new normal with nose and mouth masks and people cleaning. We're doing like strange outside, as you can see. But after they got there, and now we are just finished today, the 3rd week, and since we didn't have any positive since then, so I think we try to create a health bubble, and it's very important to every Monday we get on the training facility and we speak with the players and we tell them there was no positive. So I hope for the first week we have the same, and then start to create a confidence on them. So we didn't have no positive on their families, the ones that we're taking care, and with the staff and the employees of the training facilities at all. So now they're very happy to be there, to be practicing. So now here, even in Brazil, people are saying that our training facilities is one of the safest place to be. And this is very important for us because it's a lot of efforts, and we know that it's going to be a very big challenge for all of us, especially for us as doctors, as team doctors. But we know that we need to move on. And if we don't have a solution for the COVID right now, we need to understand how to take our lives, our training, our games with this new issue. And this is what we're trying to do here in Brazil. So thank you very much. And fortunately, we'll be back with you guys again. So it was a pleasure for me to be sharing our experience here in Brazil and to be listening to you guys.
Thank you so much. Thank you so much. And now I will ask Jens to introduce our next colleague. Go ahead, please, Jens.
The next colleague is Xavi Valde from FC Barcelona in Spain. And he was, as I see, the last president of the European Collector Sports and Exercise Physicians. And his topic will be the effects of detraining on muscle and tendon injuries after COVID-19. Welcome, Xavi.
Thank you, Jens. Thanks, everyone. Good morning, good evening. It's a pleasure to be here, and congratulations to my previous colleagues for the great talks. As you can see in here, I'm going to talk a little bit about which are the effects of the training and which can be the risks of this detraining on our athletes, the risk to suffer muscle and tendon injuries. This is a talk that has been prepared with my friend mrdical, which is the sports science work with me here in our second senior team. And what I'm going to do is to review some data from the Bundesliga, which is the first major football league resuming competition, then to show some data from literature that can help us to imagine what we are going to face, and then also show two examples from FC Barcelona players. Next, please. Next slide, please. Everybody, click 3 times, please. Everybody around the world from several sports, NBA, Australian football, several continents and countries, everybody's worried about how, after this long break, to resume athletic activity is gonna affect our athletes. Next, please. Yeah, thank you. Bundesliga has been the first football league, major football league restarting activity. And as you can see in the top left and right part of the slide, the first 2 match days, performance data were quite similar to the previous and the teams had before the lockdown. But the last 2 match days, you can see this in the inferior left part of the slide, these performing data has started to slightly decrease. And this has been happening despite the change in the rule that the teams are able to make 5 changes, which is a reason to keep performance data quite normal or even higher. And teams are using this rule. 9 of every 10 teams are making 3 or more substitutions, and they are also making these substitutions earlier. As you can see, they score a record of substitutions during the halftime. Next, please. Previous, please. As you can see in here, despite this increased number of changes and even sooner, it seems that the number of injuries that we are seeing in Bundesliga during matches is 3-something times the number of injuries that used to happen before the lockdown, and around 12% of the athletes, of the players, are unavailable to play for their teams. Next. When somebody has to do something for the first time, the only thing can do to prepare itself is to try to look for similar situations, or situations that he thinks they're going to be similar to the scenario he's facing. this is an unknown situation. Nobody has prepared something like this before, or had to face something like this before. And the only reason to do something like what we are doing now is because we are forced to do it. Next, please. One of the things is everybody concerned about is the time we are going to have to, next please, the time we are going to have to prepare, to use as a precision to prepare our athletes for the competition. And as this paper shows, a good design of precision is very important. In fact, for every 10 precision training sessions, our team will be benefit for less layoff days. The incidence of severe injuries will be also lower, and the training attendance and matchability of our players will be greater. Next, please. Also, the congestion. So we have been stopped for 2 months, and then now we need to recover a lot of matches and increase the density of the competition during this time until the end of this strange season. And as everybody knows, the too much congestion cycles already has a negative detrimental effect on the risk of suffer injuries. But the 3 match congestion cycle that is going to be the more likely, more common cycle to face during this time is even worse for our athletes, especially for indirect injuries and more common cycle to face during this time is even worse for our. And then is the especially for is the indirect injuries and more common cycle to imbalance time is even worse for our workload ratio. These are data from the Premier League. Next, please. And basically, to resume it, to summarize it, the message should be: we need to avoid the spikes that approach or exceed 2.0. But to do that, we need to be able to do a good precision, a very good training sessions previously to the start of the competition. Otherwise, this acute chronic ratio is going to be unbalanced. Next, please. What happened? Next, please. Another thing that we can use as a scenario or situation to pre-visualize what is going to happen to our athletes. When we send our athletes, our players in holidays, they are 4 weeks, not in a lockdown. They are in holidays. They are not closed in a flat with a small space to move. And the effects on their body are really important. We know that the lean mass and the strength small and also and the effects on everybody knows how body are really strength levels, and especially we know that the lean mass level how and the strength are small and also strength and everybody knows how body energetic strength levels. We know that the lean mass level how and the strength are muscle levels and also reduce and everybody knows how body energetic strength levels. We know that the lean mass level how and the strength are muscle levels and also reduce everybody knows how the energy strength levels. We know that the lean mass levels how we do body weight also reduce everybody knows how the energy strength levels. We know that the lean mass is not being we do body weight also reduce everybody use more than 2 years of the lean mass is not being the last body also reduce the mental effect on the biomechanical capabilities of the tissues, especially the tolerance of the connective tissues to tolerate loads is decreased. Also the bone density, but for me, I think is especially important. This reducing capabilities to tolerate load of the connective tissue, as we will see later in another example that I will show. Next, please. This is the example I was talking about, is the lockout from the NFL teams in 2011. This is a paper that has been very popular recently because of everyone is looking for examples to understand what what is the scenario we are going to face. Next, please. And in a normal NFL season, the number of Achilles ruptures, this is a study of 5 seasons, as you can see, is 5, 2 during the preseason, 3 during the regular season. After the lockdown in 2011, just during the preseason, 12 Achilles ruptures. And I want to insist, these players were in a lockout, that they were able to go to private gyms, they have resources, private coaches, and they could do many things. And despite all this, these were the consequences. Next, please. So I'm going to finish my talk with showing you 2 examples of situations that we had to face with some FC Barcelona players. Next, please. This is a center back, and as you can see in this graphic, is a guy that he is not playing for many weeks. He's not playing regularly as a starter. Then next, please. Then he played 14 minutes in one game. Click again, please. And in the next week, he was he was one of the starters of the match. And as you can see, after 80 minutes of match, he asked for the substitution because he was with muscle cramps. Then the week after, he played just a couple of minutes, and in the next match day, he was able to complete the 90 minutes of the match without any problem. Next slide, please. I think you have to click twice, please. So when we review this player training data from the previous weeks, this is the high metabolic load. This is a data from our GPS system that is trying to show the metabolic load related to distances running with high metabolic demands. And our athlete is the one in red with the red color and the star on the top. And if you see, these are data from all of our center backs. He is training very well. His data are really good, and even some of the weeks he's the guy with the higher data. Next, please. Click twice again, please. And this is the same period of time, and in this case what we are seeing is the highest speed running, which is the distance he is running faster than 21 k per hour. And again, he is doing a great weeks of training. Some of the weeks is the guy with the higher values and doing a very good work from him, from the physical coaches to keep him fit. Next, please. And in the graphics in the left, what you can see is that this work with this guy during the previous week was good enough to keep the acute chronic ratio balanced during the 2 matches. The one with the red, highlighted in red at the left, is the one when he asked for the substitution after 80 minutes. But you can see that he was with a good balance ratio, and the other one is the 2 weeks later when he was able to finish and complete the match. When a player is not playing in regular basis, we do extra training for these athletes because of that, to try to try to have this result. That is, when he had to face a competition, the acute chronic ratio will be balanced, and we are not putting him on risk. But there is what we can deduce from this situation is for good the training is designed, and how as better the player is training, it's very difficult to reproduce the tension and the stress you put on our players during competition. Next slide, please. And this is a case that, next please, this is totally the opposite. This is a guy, he is again a center back, and he's a guy that is playing every single minute for many weeks. Next, please. Then 1 week, he was promoted to the first team to play with our first team, and just after 13 minutes, next, please. Just after 30 minutes, he saw a red card, and with the funny situation that this was at the same time that there were a FIFA data, so for the reason to accomplish the 1 match sanction for the red card, he was out of competition for weeks. So we are talking about a guy that is not injured. He can fully train. He has full resources can go to a gym. He has strength coaches and everything. The only thing we take out is the capability to compete. Next, please. Next, please. So this is in here you can see the week that he saw the red card with the first team. The next column, because this guy was playing all the minutes for many weeks, the physical coaches, they decided that they will take a less intensive week, so they reduce a little bit the load. The third column is a normal training week for him, and the fourth column, the one with the ball, was the week, the training session week previous to the first competition match again. Next, please. And this is the video where you can see it's 71st minute of match, and he is stretching his calf because he is having muscle cramps, and every time the game was stopped, he was stretching his calf. Because of a technical situation, he wasn't replaced, so he finished the game. Next, please. And again, no, previous, please. As you can see, the ratio was balanced. So this was a guy that was kept on the safe zone, talking about this acute chronic ratio, and but still he was with muscle cramps and having some hard time at the end of the match. Next, please. And the consequences were, you can see here, the MRI sequence. So it's a funny, interesting. Imagine he was. These are the consequences of the cramps. He was able to keep normally training after the match, and he played safely and perfect the next match day. But I think it's interesting to see the effects of this situation. Again, next, please. Again, I insist, the only thing we took out from this athlete was the competition. Next, please. And as you can see in here, this is the high metabolic long distance during competition in the previous, compared with the column on the right is the match when he was suffering the muscle cramps, and the columns on the left are previous matches. So that match wasn't even one of the more demanding matches he had to face. And despite all this, he was struggling with these muscle cramps. Next, please. So we are facing an unknown situation. It's something that we learn things from it. For me, the main message of the talk is even the best training cannot replace competition. Competition gives something extra to our athletes, and is the last point of training. And most of our players, they train when they play. So despite all good work that will be done for sure for sports scientists, physical coaches, team doctors, we'll have to face some bumps on the road. Thank you very much.
دكتور مراد استاذنك بس تعمل شات كده سريع، بس هنبعت ايميل باللينك الجديد وارجع لك تاني.
اوكي.
ايه اشتغل الصوت. دكتور اتكلم معاه.
Dr. Chavi, thank you so much for this impressive lecture, to be honest with you, because now what we heard from Dr. Tanuri and from yourself, it comes really from the field, and it was really very fruitful. Thank you so much. I know that you spent a lot of time every last days to come with this very valuable presentation. Jens, please, would you like to introduce our dear friend Daryl Osbar from Orlando?
Yeah. Thank you very much. I really enjoy to listen to all of these, and now it's an honor to present Daryl Osbar from Orlando. He will talk about the ACL prevention return to play considerations after prolonged football break. We are looking now forward to listen to his presentation.
1 minute, please.
Okay. Let me add, Jens, please, after your permission, let me add that Daryl, he serves as the head of medical at Orlando City Football Club. He's the chief of sports medicine, research director, and director of the sports medicine residency education for Orlando Health Orthopedics. Daryl, are you ready?
I am ready as soon as I see the screen.
Yes, just we will wait a bit for Mohammed today. Yes, no problem. It should work properly within a few seconds. Are you in your office now, Daryl?
No. It's probably about 3 or 4 a.m. So
I know. I was surprised because I saw behind you something. I could remember. I saw that obviously in your office. That's why.
Well, my home office has become in some ways my office during COVID. So for all so I guess I can start off. I appreciate the invitation to talk. It's certainly humble to be with such great faculty. Also, the most respect to my German colleagues for really jumping on this situation quickly and enabling us all of us, including the United States, to help follow what's happening there and be able to make changes to the policies that we're doing in our country. And so very blessed for both of you to be able to help us start off and really learn. And so those presentations were fantastic because give us really an idea of what we're dealing with. And so my presentation is not going to necessarily be about COVID as much as it's going to be about the prolonged loss of time that we're missing and the effects that happen, just as the prior presentation discussed. And so I really want to give everybody a look at, what I think about, especially as a knee surgeon, and what we try to prevent in terms of our athletes ever needing knee surgery. And so I'm going to talk a little bit about ACL prevention that we always talk about just through the eyes of what COVID has done to us from a prolonged break. So thank you, Mohammed. Next click.
Mohammed, are you ready?
Go ahead.
Please. Thank you. Go ahead, Daryl, please.
Next click.
Okay.
So as everybody knows, and I don't have to repeat all this, an ACL injury mechanism is obviously a very important thing to understand, and there's a lot of variables and movement types that need to be considered because it's a complex movement dysfunction that occurs, which really typically happens from a reactive moment with a closed chain moment resulting in a dynamic valgus or a hyperextension type mechanism. Next slide. So there's a lot of non-modifiable risk factors that can occur, which all of us know about that we can't necessarily do anything about. But next slide. There's also several modifiable risk factors that we can do things about. And so every person that I talk about that's had an ACL injury and we subsequently do surgery and try to return them to play are the same things we need to be telling people to prevent the ACL injury in the first place. And so so those things are strength deficits, the altered neuromuscular control. I think about this in terms of many different factors. When we talk about neuromuscular control, often we kind of just say the term, but I think about what's happening to the ligament, what's happening to the leg, the quadriceps itself, the trunk, And also, I talk about dysfunctional movement patterns and how the athlete is anticipating, making themselves ready, and having as quick of a reaction time as possible. Next click. So often, when we think about this, we think about other animals in the world, and obviously from a squirrel's perspective, we don't necessarily hear or see squirrels actually having this injury. Next click. And if you see squirrels actually running, they will run more two-legged. And that's why their knee bends in a flexed position. Next slide. But as all of us know on the call in this webinar, many dogs can actually have ACL injuries, and often they are pushing off an extended foot. And when they cut, and especially in an unexpected situation, they can suffer an ACL tear. And so this isn't just an injury that occurs in humans. It's also an injury that can occur if people or animals sustain a certain effect to the knee in that dynamic valgus movement. Next slide. So a lot of prevention programs have been developed, including the FIFA 11 Plus that all of us are aware of. And the goal is to help prevent injuries, and they can be done in a very fluid way. But when we're trying to get back from a prolonged break and trying to get players back, as was just discussed in the last presentation, often there's a fatigue and fitness perspective that's not being taken into account. And are these players actually ready to prevent their ACL injury? Next slide. So the four main considerations that I consider with, how do we get players back after a prolonged break are, first of all, the fitness, fatigue, and sleep and recovery that are essential. How is their muscle strength and coordination, which the last presentation actually went into greatly in terms of understanding the complexities that go into when players have a prolonged break. Their lower extremity neuromuscular control, how do they use these muscles to really allow them to cut, pivot, and twist successfully, or jump and land in other sports? And what's the movement pattern optimization that we're working on and how we can prevent it? Next slide. So if you look at lack of fitness, sleep, and recovery and leading to fatigue, obviously that's something that all of us know. However, when you really look at how is a fitness associated with injury risk, there are some studies, and this is one study that wasn't necessarily done with a high number of players, but did show that there could be increased injuries with a lower VO2 max and lean body mass, as our last presentation talked about. And so if you have these players with less fitness, with more fatigue and decreased muscle mass, this can potentially result in increased fatigue and subsequently increased injury. Next slide. So I think we need to look at fatigue as a football vital sign. And so it's very important when we start thinking about an approach to the role of fatigue, especially in prevention of injuries and including an ACL injury, which is devastating to a football player. We need to think about this when we're talking about these players, especially when they're returning back in unprecedented times. And so when we look at that increased injury risk, it's both a psychological response with increased anxiety and emotion, physical response with increased fatigue and decreased performance, and that imbalance with stress and recovery can literally lead to injury risk. Next click, please. So when you look at the ACL injury mechanism itself, all these variables go into play, and this is why I always talk to somebody about, why does it happen on one specific moment when they've been playing their entire career? And I think this is the risky time we talk about when we're in this situation, which is unprecedented, that we need to consider to make sure our athletes are prepared to do the movement patterns they need to do to help prevent subsequent ACL injury. Next click. And so if we go into all these things that are important, it's sleep, recovery, anaerobic and aerobic fitness, their mental imagery, how they actually vision themselves cutting, pivoting, twisting on the field, which I think is one of the most important things about a FIFA 11 Plus program. They are practicing from a neuromuscular perspective before they participate in a game, and so, or in a practice. So when they're actually going through those things, they are teaching themselves again to be able to cut, pivot, and twist and move properly on the field and have that motor learning process and help reactionary times to be able to prevent injury. Next, click. So once we've hopefully had an athlete that's able to have the fitness to be able to participate, we also need to think about all these other things that I talked about before, including your muscle strength and coordination. And by muscle strength and coordination, obviously, we're not just talking about the quad or the hamstring and the balance. We also need to think about the core and trunk strength. We need to think about pelvic stabilization because we can't get hip drop on the opposite side. Our posterior chain activation, which obviously in a lot of our athletes is not necessarily done well, and they avoid the posterior chain and become quadriceps dominant, which can lead to an issue with ACL injury itself. And then also we need to look at the foot and make sure that we have balanced activation through the foot and supportive orthotics. And these are things that just in general we need to do for athletes, but especially in a prolonged return that we're having in a COVID situation, we need to even be more thoughtful of this, especially in our high-risk athletes. Next click. So if we look at the neuromuscular control considerations, we need to think about the mechanism component, the underlying neuromuscular imbalance, and the targeted neuromuscular intervention that we need to think about. And so we need to really train for proper technique. Even if we have the proper strength, we have the proper balance of strength, if the technique isn't proper, we need to consider it. Next click. The other thing is this connection between the neuromuscular control as well as quality movement. Next click, please. Or next slide, please. Yes, thank you. We need to think about this connection between the neuromuscular control and the quality movement. And a lot of athletes, when they have an ACL injury, they will not necessarily be prepared for the movement pattern they're about to have. And so we need to effectively coordinate the muscle activity to protect the knee joint. And it requires a quick reaction time at the neuromuscular level to do so. And so we know some data based on gender that sometimes men will have quicker neuromuscular feedback than females will, which is one of the risk factors. And so we really need to make sure the athlete has time to generate the neuromuscular response to have the right ground reaction force through the knee. Because if they land stiff-legged in a non-preparatory way, they're going to significantly increase this ground reaction force to the knee, resulting in potentially dynamic valgus and a pivot shift mechanism. Next slide. So when we talk about the movement patterns themselves, every athlete must understand that safe movement patterns are learned, and they need to be continually learned. And so as we always know with some of our athletes, there is natural selection, and some of them are more prepared to prevent an ACL injury. And this can be based on those non-modifiable risk factors with anatomy, but also can be based on the quicker response time that some of our athletes and the better preparation they have. So even if they have great fitness, strength, and neuromuscular control, the athlete can still injure the ACL if they're not thinking about the movement pattern they're doing. And if they're more risky in these movement patterns, especially in these times as we're trying to get back to play in unprecedented times, then certainly we can potentially see an increase in ACL injuries. And so we need to consider this electromechanical delay. And as I stated before, men typically have a shorter electromechanical delay than women, and a quicker response time for force production. So if you think about this, this is why one of the reasons we can see an increased risk for ACL injuries in our female population versus our men. And for me, this is important because I not only take care of Orlando City, I take care of our National Women's Soccer League team as well. And so we are concerned about this as we try to return them to the field as well. Next click. And this is a good representation of what I'm talking about. Is you can see in the upper right frontal camera, we have a pass going from number 18 to the right, and the player is trying to prepare for this pass and trying to push off with the right leg quickly. And you can see the leg is going to a dynamic valgus with hip adduction, dynamic valgus at the knee, and pronation at the foot. And this is what we don't want to see with that in a preparatory movement pattern for an athlete like this. And certainly if they're fatigued or they aren't fit, we can see that if they are delayed, things like this can happen. Next slide. So what is our ACL prevention program, and how do we determine readiness for football, at least in Orlando? So we think about return to play criteria, and that's time and criteria based if we're dealing with the patient after an ACL reconstruction. And certainly all of our players that have had a history of ACL are high-risk players. And so these are some of the things that we're going through right now to make sure that they are able to respond and ready to be able to have the correct movement patterns, because we don't want to obviously have an increased uptick of ACL injuries. We need to look at objective data, psychological data, it's been talked about on the call, but also this transition to play and transition to fitness program, I think about seriously, not only after our ACL reconstruction patients, but also in prevention of ACL injuries. We need to make sure that we're doing sport-specific movements correctly as we go from predictable to non-predictable. These athletes are able to, and these football players are able to keep their movement patterns to prevent an injury, not only to the ACL, but other structures as well. And this transition to football fitness is important as well. As we increase the minutes, they need to maintain these quality movements. Next slide. The other thing we think about when we're evaluating, this is obviously an athlete that's doing a single leg hop landing with their eyes open. So a very predictable movement here on the left-hand side. If we go to the middle slide, we can see if their eyes are closed, that movement breaks down. So as we get unpredictable and they're not able to actually understand with visual cues what they're supposed to do, that movement can break down. If we go to the one on the right, if they take a little contact, that movement can break down. Again, if they don't have the right electromechanical delay or they don't have the right movement pattern to help protect themselves, these things can break down when you add unanticipated variables into the equation. Next click. We do use some technology, including Noraxon, to actually put some information and some angles measurements behind what we're doing. And so this has been useful for us from a tool perspective for ACL prevention. Next click. Another thing I talk about is the effect of this nonlinear spring-loaded brace, which a lot of people might not know, but actually we have used this for anterior knee pain in some athletes because it actually improves balance synergy through increased posterior chain activation, decreased quadriceps dominance, and decreases the hyperextension tendency through the knee. And so I found that this has even been useful in some of our ACL prevention techniques as well. It's called the Descend brace, to really use the spring-loaded mechanism to hopefully allow the quadriceps not to be as dominant and to help prevent or allow for increased movement patterns. And so we've been using this even in the post-op setting for ACL and started to use it in some of our athletes that we think are at higher risk. Next slide. So in summary, overall, when it comes to prevention or dealing with an unprecedented time like what COVID has presented, I think we need to have a mission, vision, and plan. And what we talk about is this MVP-style program. Because from an ACL injury risk, which is a devastating injury with a long time out of play, you may not see it, but it sees you, and that risk is going to continue to see us. So to me, everybody is at risk. However, an ACL injury risk is a huge warning sign, and we need to make sure that these patients that have had a history of an ACL injury, especially if they're coming back in this situation, that are given the time and care to make sure that we're thinking about prevention. And so we need to optimize fitness, decrease fatigue, enhance muscle strength and coordination, enhance the lower extremity neuromuscular control, but also allow for movement pattern optimization. And ideally, we need to individualize the programs to the athlete, and practice makes perfect. We need to make sure that they're doing this on a continued basis during training and before games to make sure we're able to prevent these consequences. Next click. I just point out this article that's come out recently about returning to play after prolonged training restrictions in professional collision sports, and I know Mauricio had showed this as well. And so I think this is a great resource that people can utilize to provide some more additional information to learn about how we deal with some of these prolonged training restrictions in place. Next click. Next slide. So that's all I have. So I appreciate it again, being part of this great webinar.
Thank you so much, Derek. It was always impressive. And Jans, please.
Yes, thank you very much. And next speaker will be Bruno Marier, as I think, from the performance department, and Louis Til Perez he's the head of the medical services from AS Monaco in France. Thank you very well. Thank you. His topic will be the return to football after COVID-19 lockdown, load management and injuries prevention. Welcome.
Hello everybody. I've enjoyed a lot the previous lectures. Xavi and Dario have pointed out on some key points that worry me a lot. I'm happy to be here sharing and learning from the best, and the best in this moment are the professionals who are in the pitch side, helping the players to restart football. Thanks, Dr. Mustafa Hashimi, thanks, Dr. Mudar Gaidi, for organizing this nice meeting and for the opportunity for your kind invitation. On behalf of AS Monaco, I want to introduce my colleague Bruno Marier, who is going to share with you how and why we organize our strategy after the COVID lockout. Please, Bruno.
Thank you for the invitation. It's a pleasure for me to be here. I'm here today to talk to you about the post-COVID strategy with a sports science point of view. Okay, to better understand our approach, and because each club has a specific context, I would like to give you an overview of the situation. Our club should start the new season around August 22. We are still waiting to know the official date. So between 16 March and 22 August, we have a period of 23 weeks without competition, with a 8-week period in quarantine during the months of March and April. As you know, the situation is without precedent and puts our club and the other in a difficult context. The situation is ever more difficult because we have no reference which could help us in our decision making. The important thing is therefore to put the team in the most controlled and objective context. Next slide, please. Okay, the best way to achieve this goal is to build it on the multi-skills of the staff, of course, but also in searching information outside the club. Next slide, please. On this slide, you can observe the 23 weeks between the end of the competition and the probable start of the League One Championship. We have cut these 23 weeks into 4 phases. Each phase has a specific guideline. Next slide, please. The phase 1 concerns the months of March and April. The staff did the best to limit the effects of quarantine on the physical fitness, with the hope of returning to competition in June. Indeed, at this period, we thought the competition would start again. Next slide, please. For that, strength and conditioning coaches implemented the training program. Sports scientists monitored the fitness fatigue level of each player, and they quantified the workload based on daily happy data. Practical recommendations from the scientific literature have been given on different thematics. For example, how could you improve your sleep quality, some tips to preserve your muscle mass. Then nutrition challenges were organized with photos of the meals to send to the nutritionist. Next slide, please. During this phase 1, we adjust the training contents in the light of new information. The first information came from a scientific article published by Gregory Meyer in 2011, as presented by Dr. Valle, Barcelona. This author described an interesting experience in American football, and this context is very interesting to know because it's close to our context. This article shows that players have plenty of Achilles tendon injuries, 12 ruptures in 1 month and 10 over the 2 first weeks were reported versus 5 ruptures per year usually. Why? Because it's a negative effect of a long, no specific training period. The muscular and tendon tissues weaken quickly and increase the risk of injuries. Could you start the video, please, on the right? It's possible? Okay, perfect. To avoid that, it's very important to integrate specific exercises to stimulate gradually this tissue. At the same time, some specific experts like Jean-Benoît Morin, biomechanical expert, explain us that to avoid injuries after this quarantine, we must continue to stimulate the musculotendinous system of our players. So, as you can see in this video, we have implemented new specific exercises to move in this direction. All of this information will be decisive for the health, the fitness, and performance of our players. Next slide, please. Okay, here you have the study that I spoke about earlier. Next slide, please. Okay. Before beginning the phase 2, I would like to emphasize 2 points created by this quarantine context. The first point is the strong heterogeneity of physical fitness And the second point, we must be very attentive to musculotendinous level of disadaptation. Next slide, please. The phase 2 concern May and June. Currently, we continue to send training program to our players, and we are following the injuries in the other championships, which are finishing their season. In this way, we increase our level of vigilance on specific problems related to quarantine. Next slide, please. Next slide, please. Okay, thank you. So we monitor mainly German, Spanish, and Italian championships. This information will help the technical staff to anticipate the management of the training load and help the medical staff to organize the prevention strategy. It's very interesting because some injuries have begun to appear. For example, calf injuries have been reported at Barcelona and Milan AC, which correspond to the scientific literature present just before. Next slide, please. So our biomechanical expert gave us some advice to improve our training content. In his opinion, it's very important to program at least 2 sessions per week of neuromuscular work. Each time, the exercise have to be done with the intention of being at maximum intensity, while imposing a high level of mechanical stress to stimulate the musculotendinous system. For that, he gives some specific exercises such as allowed uphill sprint, pogo jumps, repeated maximum jumps, and high speed actions. The next slide, please. When we discuss together with Jean-Benoît, a second point seems to be very essential. Indeed, the football boots are very rigid, and our players have lost the habit to wear this type of shoes. It's crucial to consider it because the mechanical stress are more important with football boots. And Achilles tendon and calf will be very impacted by the mechanical vibration. To avoid this problem, we advise a gradual increase of time spent with football boots during the first training session. The right graph shows you an example of how we can manage the time spent with football boots during the first 8 training sessions on the pitch. Next slide, please. Another point seems to me interesting to share with you. The aim here is to show you the need to program plyometric work progressively. Indeed, as you can see in the slide, the level of constraints is not the same. The patellar tendon is not impacted with the same load. During a classic strength exercise, the load represents 2 times the body weight per second, while on a plyometric work, as we can see in competition, the tendon load equivalent to 38 times of the body weight per second. Therefore, it's very important to introduce explosive body weight resistance exercises to decrease injury risks. Next slide, please. During this phase 2, we continue to send the training program to our players, and as you can see, we start to introduce neuromuscular exercise. I think also that it's a good period here to increase the time spent with football boots. Next slide, please. During the phase 3, at the end of the June, we will test the players to individualize their training program. 3 targets for us. Next slide, please. Okay, thank you. Complete medical assessment, a specific focus on their immunity, and particular attention on their cardiac function to limit the risk of viral myocarditis. Besides this test, we will use some mechanical tests such as flexibility, mobility, and force capacity to identify risk of muscular injuries. A major discussion around this testing period is work in progress, in particular on tests requiring maximum effort, such as isokinetic strength test, for example. Next slide, please. Finally, during the phase 4, we start the pre-season phase, which is to prepare the return to competition. This phase will have a duration of 8 weeks. Next slide, please. During this phase, we are going to be organized around 2 guidelines. The first concerns the fitness status monitoring, and especially the monitor of muscle and tendon adaptations. The second concerns the workload management, and particularly the management, control and chaos continuum. Next slide, please. This 8 weeks phase will be split into 3 periods. The first period will concern the individual training of the players. During the second period, the training will be done in small groups, and at the end of the 3 weeks of work, the training will be carried out with the whole team. Next slide, please. During each training, a process will be implemented. When the players arrive at the training center, we collect data on their fitness status. What is the level of DOMS? What is the recovery level? If we note high levels of muscle soreness, we look at the level of creatine kinase. 30 minutes before the training, the beginning of the training, we give the report to the strength and conditioning coach and to the doctor in order to adjust the training program of players. And after the training, during the training, we monitor in live the physical activity of each player with GPS units. And at the end of the session, we give a report which describes the physical constraints imposed to the players. These parameters give us an idea of mechanical stress imposed to our players during the training. Finally, a meeting with the doctor, the sports scientist, and the fitness coach is organized in order to talk about the soreness appear during the session, or to talk about the evolution of soreness detected before the session. The last meeting is for me an essential step in our preventive strategy. Next slide, please. Please. Okay. Besides this work, we implement workload longitudinal analysis. We focus on 4 variables: high-speed running, distance above 25 kilometers, speed max, and the sprint number. We pay attention to the high intensity. Next slide, please. Concerning the strategy of the workload management, the question is to know if we shouldn't implement a rehabilitation strategy. Indeed, the player don't stop general training, but stop to train with specific football skills. We are almost in the same situation when a player comes back to from injury. That's why we think it would be an interesting idea to implement in this context a rehabilitation methodology. In this way, a scientific article written by Matt Taberner is a reference for us. This article talks about a control to KO continuum. The control is to put the player in a safe practice, which could be specific to football, while chaos refers to a practice as imposed by a football match, such as a random change of direction or high-speed physical contact. Next slide, please. On this slide, you can see the different choices that we have to parameter optimally each week, although we could build our strategy. At the beginning, we will organize short session, for example. We will do a day on and a day off. We will build step by step a typical competition week, and we can implement session under control or session under cow. But even if we implement a session with control, we try to integrate high intensity. Here we develop our program as if we work with an injured player. Next slide, please. On this slide, I give you the details of our workload strategy. 3 principal guides us in this process: the volume, gradual increase towards match reference; the intensity, control KO continuum, as I explained before; and the frequency towards a typical training week. Okay, next slide, please. All this information will be one of the keys to engage the team in the good way before the start of the competition, even if the situation requires a lot of humility. Thank you for your attention.
Thank you so much, Bruno. And Till, you will complete the presentation, Till? You have something to say, Till? Louis?
It's the same presentation we shared together, and it's all from our side. Thank you.
So thank you so much. So please, Jens.
Yeah, now it's my honor to give the floor to the president of the medical committee of the UAE, is Mustafa Al-Sayed Al-Hashimi, and he will talk about aspects of medical advices to the UAE footballers during the COVID-19 outbreak. Thank you very much.
Well, again, it was an honor to have you here with us. I want to really thank the UEFA and Dr. Murad, the director of FIFA Medical Center in Dubai, and all the lecturers. Really, I have learned a lot of things from them. It's honestly a pleasure and honor. Basically, I'm going to talk about the aspect of medical advice in UAE. You know, UAE is a tiny little country. We did everything possible that, we planned very well that we probably can start something in July. So next slide, please, Dr. Mohammed. Basically, I'll talk about the UAE overview, a action plan, plus the, our initiatives actually of our champion in your safety. And then about the webinars, a couple of lectures we have done for our players. Next slide, please. At the beginning of the events, actually, it was shocking definitely for all the countries, all the persons, especially for the football community. UAE government did everything possible to announce, after the WHO announced of the COVID pandemic. The political message basically is that was to ensure and emphasize on the readiness of the high standards of healthcare services, clinical staff's availability of their tests and so on. So the second thing is that they're doing a sort of national sterilization program for all the malls, streets, availability of making sure that sending message to the public that availability of daily essential need for all the inhabitants. Arranging prevention campaign by all health authorities at federal and local level to enhance awareness of COVID-19 prevention program through media at large, using, basically social distancing, wearing masks, wearing gloves, and so on. So second thing is that to make sure that mobilize federal and local authorities to support the COVID-19 preparedness plan. Next slide, please. So about the UEFA action on January 22, 2020, the UEFA Medical Committee freeze joined team for participation in the federal tournament in Hong Kong. Second thing is that the AFE on February postponed the ACLA match. On the 4th of March, the UAE Federal decided that all football competition in UAE will be played without the presence of fans. We will back on the 9th of 20th on the March, the FIFA and AFC officially decided to postpone matches for the all 2022 World Cup and the 2023 AFC Asian Cup until further notice. On the 12th of March, UEFA postponed the match in all competition of the age group until further notice. Now, on the 15th March, the UAE Football Association has decided to suspend all the football activities in the UAE for the season 2019-2020 up to 4 weeks. Next slide, please. Now, we had a great initiative by His Highness Sheikh Rashid bin Hamid Al Naimi, the President of the UAFA, by launching a Champion in Your Safety initiative, which basically bringing a bunch of football celebrities to sort of help educate and some safety message for the whole community, actually, to be aware of the COVID-19. Next, please. We'll show you basically this video about the initiative.
اليوم نحن نتكاتف يدا بيد في دولة الإمارات العربية المتحدة التي اتخذت العديد من الإجراءات الحراسية من أجل الحفاظ على سلامة كل أفراد المجتمع من مواطنين ومقيمين. ونحن بدورنا قمنا بإيقاف أنشطتنا ومسابقاتنا من أجل سلامتكم. حافظوا على صحتكم في بيوتكم لأن بطولتنا هي سلامتكم.
The other thing is that also the UEFA has offered its facility at the disposal of the concern of health authorities against coronavirus. There's a huge facilities we have actually here. It's new, brand new. It's almost 2-3 years old now, and it has so many, trains actually on the facility. So we did that for the authorities. Second, please. Now, on the 12th of April, actually, the Football Association decided to extend the suspension of the football activities in the country as of today and until further notice. On the 29th of April, the UFA, in continuous coordination with the league and the health authorities, to resume the football activity. Initially, we're thinking in August, with definitely a continuous evaluation of the situation in the country. Next. Now, coming back to our championship initiative, actually, with safety. So many of our elite players and the referees, they participated also in coordination and cooperation with the SAHA. It's in UAE medical facilities, authorities actually, in testing the public. And that was a great message, because when you bring those celebrities, in the public and sharing with them this all concern, probably the message of the awareness and education will be much more, there. Second, please. At the same time, actually, in the UFA, our medical committee members has, contributed through so many lectures for our players through the country, to make sure that our players get those message about everything that my colleagues actually mentions from United States and from Germany and from France. All of them actually mentioned about the psychological impact and the long term of I am basically after them and before the of this period actually. So it was very important for us prepare our players for these occasions. Next, please. Now, basically, is that of the almost 3 months, actually, the players are basically confined to their home. So what we did is that we encouraged them actually to do the exercise and to keep up with their medical team and the clubs, in case if they have some problems, if they want to ask any questions, and we were always supporting them that to make sure that you have to control your weight, definitely, because and sleeping behavior, because basically that when we return back, so they will be fit for that. The other thing is that those all messages are very important, and definitely we are waiting very hard actually for our the experience that the German has now. Probably I think the whole world are waiting for the German experience, and we are looking strongly for that. Second, please, next. So thank you very much, and again, it was very honored. I have learned a lot of things actually today. I will definitely use it actually once we start our league. Thank you. Murad?
Dr. Murad, open your mic.
Dr. Heinz?
Thank you so much, Dr. Mustafa. Really interesting, and fortunately, Mubarak is not there to introduce our last colleague, Franček. So please, Jens, go ahead and introduce Franček.
Okay, our last speaker, far away from us, he's in China now, and this will be Franček Drobnik. He's the head of medical services of SFC Shunhua Greenland FC in China. Welcome. His speech will be about the pre-competition cardiorespiratory assessment in professional football after the COVID-19 lockdown.
Thank you, Jens. Thank you, Mubarak. Thank you, Murad. Thank you all of the people who is hearing this speech. Good morning, good afternoon, good night, good evening, whatever. This is a very interesting field because we know that our players, they are in a good shape, in a good condition. At least they were in a good health at the beginning of the season because of the pre-participation examination we did. But at this moment we have to evaluate the introduction of these players into the high-level exercise. Please, the next slide. We'll go with next slide. Do I have to pass? No. Okay, great. We have a lot of guides. Most of them they are with the same items to avoid basically the sudden death, cardiac death, or whatever other problems related. We here at the Shanghai, we are using the one that we made when I had my later job at Football Club Barcelona, our guide. It's a very nice guide, hoping sometimes they will be published, or the medical evaluation of the National Federation. Anyway, next slide. At this moment, at the reintroduction, there are a lot of guides related what we have to take in care about the health of our athletes, not only to avoid new infections on the families, the neighborhood, or the people who's living around our players, but for their health. So we have been working in the evaluation of this part on the National Sports Medicine Association and the ones in the Rugby Federation. So the most important, can you pass the slide? we know that the medical participation examination has different points, but as I told before, I told before, those athletes are in a good health. So at this moment, the next slide, we have to make the examination basically for these 3 points. One is to identify the problems related with this pandemic, problems related basically with the tour of entrance of the virus and the most affected system, that is cardiovascular and respiratory. And of course, the 6th point, because we have to take care of that. If we have some problems, respiratory problems, cardiovascular problems of these subjects related or not with the COVID infection, the assurance will ask if we have done the correct evaluation at this reintroduction. Next slide. Okay, we have all the things related with the immunological response against the virus. I'm not going to go into this, but we have to take care that there are 3 points. Next slide. That we have to measure the ARN, the PCR, or the IgM or IgG values. Next slide. So at the introduction, we have 3 types of players: those that have never been infected, those that have been infected but they are not affected, they have no illness, they went through the infection without symptomatology, no things. And those who had really an infection and they have the illness and they went in a bad shape during some time. So anyway, at the beginning of the training, we have to take this evaluation, the late evaluations I told, PCR, IgM, and IgG, and the subjects in this slide have to present different values of their immunoglobulins, but they have to have the PCR. Next slide. Yes, great. The PCR has to be negative. I want to take one point into consideration. Some subjects had a PCR that is not negative, even they are in good health after their problems, their illness, and this is basically because there are fragments of the virus on the mucosa that they will be for the time that they renew all the tissues. So if we have these subjects, these players that they have a PCR positive, we have to conduct a complete genomic evaluation of the virus to evaluate that this subject can train with the rest of the companions because he is not spreading the infection. Go ahead. Next slide, please. And taking into consideration this nice evaluation of the probability of risk of death that we have to take into consideration, the risk of serious illness of our players. We have our players in Europe, in Saudi Arabia, in Arab Emirates, etc., around the world, in South America, whatever. The subjects, they are young, and they have a type of a possibility of contacts. Here in China, we have most of our players are in the blue square because they are really in a relatively low contact with infectious persons. So this is our shape of what our subjects are. But the most important for us as physicians is take care of those subjects who are on a risk of, if they are infected, of have more problems or other problems related with infection. Next slide. Those are those who are in the middle over here. This. And what are the risk conditions? The risk conditions are related with the door of entrance. Those with asthma or allergic diseases. Those with history problems of injury related or not with exercise. There is a very nice review of Dr. Anderson and Dr. Kipling about that. Those who have smoking habits, we in Europe we don't have very much football players who do smoke, but in other parts of the world we see that. Of course, in some places also there is a pollution environment that makes an injury, a pulmonary injury, relatively inflammation of the tissue of the pulmon, of the lungs. And we have to take also into account those with who have infectious diseases with pathogens that can make a problem on the cardiovascular, predisposed to cardiovascular disease. And I make one appointment on those players who can have a predisposition to have a thrombosis, venous thrombosis. We have done a recent study that is under evaluation. Please, the next slide, where we have seen that we don't know why, but there is a predisposition on football players or to have venous thrombosis or peripheral venous thrombosis. So maybe we have to take into account those players who have problems on the low legs or related with the training session, and evaluate if they have a predisposition, genetic predisposition. If you want to have a guide on the prevention of diagnosis of thromboembolism in sport, there is a very nice review. Excuse my vanity, but I am the first author, but I was the conductor of the evaluation of the review, and although the other specialists who were the real specialists who made this very nice review. Next slide. So going into finishing the speech, we have basically two things we have to take into account: the respiratory tract and the cardiovascular tract. Those are the changes on the lungs or on the people who die by COVID. Is really change on the arteriolar, and there is an inflammation of the lung, all the tissues of the lung. So that brings the subject to a very, 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 very poor condition, and sometimes after the respiratory distress to the death. Also, there is important that next slide, that this is what is called to bring that there is a storm of cytokines. It's okay, keep it there, keep it here, please. That's it. But we don't know what occurs with those people who don't have a very severe illness. We don't make biopsies of their lungs. We don't know how, maybe they don't have symptoms of their lungs, but maybe their lungs change in some way. So we have to take into attention those subjects with risk, those subjects who have asthma or who have allergic diseases, or those subjects who begin to present some respiratory symptoms that are not usual with them. We have to make a very good clinical history, and we have to be attending the training sessions and taking to care if they, during this time, that is late spring, and it's beginning the air conditioning on the cars, on the places, and changes into temperatures, the common colds, etc. We are under a pandemic. We have to be extra attending these evaluations. Go next slide. With the cardiovascular evaluation, there is a very, very good evaluation in a journal by a commission of a sport commission on cardiology that they explain the pathogenesis of the cardiovascular problems. But also, not being cardiologists, we have to take the evaluation of the symptoms of the subject that is with us: chest pain, palpitations, dyspnea, fatigue beyond the expected of the training, of the competition, and of course that lack of good recovery after training that can be really exposed by the subject, by the player, or even with the new systems. Please, one of the important things is myocarditis. Myocarditis is, next slide, is due to a lot of problems. Basically, most of them infectious diseases. Of course, at this moment we have to focus, of course, on COVID, but we don't have to focus only in COVID because maybe we are avoiding a good treatment for this myocarditis. I am pretty sure that myocarditis is more frequent due to another problems than of COVID, at least in a person who does not have another symptoms of anything. Go ahead, next slide. So finishing, there is only 2 more slides. Next one, please. This is, no, go ahead, next slide. We have these 3 type of players playing, training with us. So the objective of the medical examination is to assess the current health status to preserve their players' health and their family and neighborhood health. Also, or work with them is also education of the player. Next slide. And this is what we think on our proposal of clinical history and examination. Basically, it's evaluation of the immunology state of the subject, a medical anamnesis referenced of what this subject had at the beginning of the season, a medical examination, as usual we do in the medical room, and the complementary medical evaluation with an EKG, and if the subject has had or has respiratory problems, respiratory illness like asthma or allergy, etc., and we have previous values, for the spirometry is a good tool to have at this moment. So if it is normal, they can go to train. If it is abnormal, anything of these 4 points, we recommend echocardiogram and for exercise test. And of course, if there is an abnormal, go through EKG monitoring and cardiomagnetic resonance or evaluation of troponin. And if everything is normal, it's right to train. We are not inventing nothing. This is what is basically conducted by all of the cardiologists in sport. We can go with the last one. Next slide. And this is the algorithm of the section of sports cardiology and exercise of the European Association of Preventive Cardiology. After the clinical history or an examination that I proposed, this group gave this algorithm that I resume in a part on the previous slide. But I only want to point that, next slide, that if we, go ahead. Okay. Those are the type of subjects that are into this algorithm. No, the last one. I'm finishing. The other, the previous. Okay, here. It's only to say that on the left side of the slide, there is the evaluation of the 3 type of subjects, and on the second, and the middle, and on the right side are the evaluation of those subjects who have had the infection. That's it. Hoping this very short pre-participation thinking related to cardiovascular and respiratory problems will help you. Thank you very much. Next slide, with our athletes in a very good health status and without PCR, IgG or IgM by the moment, and training. Thank you.
Thank you so much, Francesc. It's always a pleasure to hear you. And now I think it's okay. And I would like again to thank all our friends for your comprehension, for staying with us. And I think I would like to thank you also for accepting to go through a general discussion, 15-20 minutes. Regarding our friends attendees, we say that everything will be posted later on YouTube channel, so they can ask their questions. Then it will be sent to the faculty, and they will see their questions and answers in rolling mode. And now, Jens, please, would you like please to lead our general discussion? Go ahead, please.
Yeah, thank you very much, and thank you for all these interesting aspects we had. And I don't know, of course, it's we have now the subjects is like the injuries, we have the preparations and everything. And the discussion will be now among us, or you want to also give the questions which you already received to discuss?
Yes. Let's go for our questions first. Then at the end, I will keep these 3 questions received by 3 good friends. Zubair Beya, the former captain of FC Fribourg. Walid Suleiman, the current Egyptian international player, and Coach Inzaghi. So I will keep these 3 questions at the end, and let's discuss between us what we had till now.
Okay, so I don't have specific questions, but please feel free if you need to know.
Daryl, you have many questions, or Louis?
Yeah. Well, I just have a quick question, if you allow me.
Go ahead, please.
Yeah. Well, I think that, I think with Jens, Dr. Jens, that basically everybody, all the countries actually, all the football association is putting their eyes and their ears very, quite for the experience that Germany is going on actually, So my question is that basically, what was the challenges of convincing the clubs and definitely the players about going through this all rules and regulation for distancing and playing and keeping them locked down for even inside the club for a week and so on. So what kind of challenges you went through actually? If there is any.
The biggest challenge in Germany we had is to convince the public that football is taking the lead, because there was a lockdown, no major activities were allowed in the country, and suddenly football appeared on the scene and said we want to go on with playing football. So this is the biggest challenge, to convince the public, convince the press, convince all the people that football can restart. And this was, of course, the biggest challenge we had. And luckily, we can see now with the development in our country, and we already have 3 weeks of playing football, and we could see that the concept which was developed is working. And now the acceptance is really high, which was not at the beginning, but now the acceptance that football started, and also that also social importance for football, for the society. So I think we gave a really good input to the whole society, that if you follow strict regulations and if you are very disciplined in the way you behave, you can go on with your normal life. Of course, it's still not normal, but you can see you give some hope to the people also that we started with the football season. And so far, luckily, everything is working really well and fine. So the biggest challenge is really, and that's what I said in my presentation at the beginning, when you do a task force, when you want to restart, you have to have a very strict program, and not only football players and not only coaches and not only medical doctors of the football clubs should be involved in starting a program. It's also, most of the time, it's a political decision, and you have to work with the health authorities together so that they accept what you are doing. And you always have to be very open. And this is what I said also, that our health authorities are checking what we are doing. So every club is tested and checked. So this was a big challenge to implement it, and the biggest challenge is to prove the rest of Germany that we take it serious and that we follow strict regulations.
Thank you very much, Doctor. All the best. Thank you.
Thank you. Any question from Daryl, Luis, Xavi?
Not at all.
So maybe, because as I said, I have 3 questions. Can I start by the first one? So it comes, as I said, it's Zubair Bia, the former captain of SC Freiburg Bundesliga. He said that high-level footballers cannot accept easily this unexpected lockdown, long outbreak. So what's about the psychological support implemented in the clubs?
I can answer a little about our experience in Monaco, about this topic. Murat, if you want.
Go ahead, please.
Yes. In France, we are lucky because in France it's mandatory to have a psychologist related to the club, and to the same that is done with medical exams at the starting of the season. We need to do for the psychological assessment for all the players. And the teams in France are used to have a psychologist, and we are lucky also because our psychologists and our sports scientists, Yann Lemaire is one of them that collaborates a lot with Bruno Marrière. They monitor the players and they assess, and most of the infographics that you show that you have seen during our Brazilian colleague presentation has been done by Yann Lemaire, and most of them have been adapted to our players. And also an individual assessment of the players is totally mandatory, because the response, the answers, and the status of the players is very surprising. It's very surprising. Players with a very strong mentality have changed a lot with the confinement, and in the other side, players that doesn't mind, other players doesn't mind anything about the confinement. For that, I think the individual assessment and to be close to the players, not only for the mental assessment, but also for to answer his questions, their questions, and to be is the help that we can do for the best for them, because they are worried, they are fear. Most of us have this. Is the first time that affront this bizarre situation, and for that we need to be close and to do as a doctor, as a team doctors, the best possible. The best possible, being close to the players and to the staff. And if you have a psychologist in your staff, it's a good help. If not, the coaches, the physiotherapists, the doctors need to be informed to answer the best for the players. That is my opinion.
Thank you so much.
I just wanted to add, because we always have to take the concerns of the players very serious. We also had it in Germany that some players are really afraid of, because they themselves are not in a risk group, but at their family, their home, they had a wife who has asthma and whatever. So it's very, very important that we take the concerns very serious, and we should really individually check the players and the circumstances and take care about it, because his concerns are true and real, and so of course they need the support of us.
Maybe I have a question for you, Jens.
Yeah, you have a question for me, or is it the question from Walid Suleiman? Which
yes, that one. Go ahead, please.
Yeah, this is we have a question from Walid Suleiman. He is an Egypt national team player from Al Ahly, and he asked that in the area now the summer starts and the high temperature is rising. So do the risk of transmission will decrease? And the answer on this is very difficult. What we can see is, because what we can see, of course, that the virus is not surviving very long on a hot surroundings, but definitely we cannot say, because now, as you can see, now the virus is spreading all over the world, and we have winter and we have summer, we have hot and rainy season in all different countries, but you still can see that the virus is spreading. So it seems to be that, of course, the hot temperature is better, because the virus will not survive in a hot area very well, but you cannot say that the virus disappears. And if right now what we can see is, it is more that the focus is really the transmission, the infection is man to man, as a person by person. It's not that you touch something, that you touch any surface and you got infected. It might be a risk, but it's a very low risk. The highest risk is that you get infected by a person from another person. So, and then this happens within seconds. So it seems to be that the temperature there has not much influence on it. Yeah, of course it has all in an influence, because if in the winter season, when more people are coughing or sneezing, then the risk to spread the virus is higher. But if you have an infected person around, it doesn't matter if it's hot, cold or warm or whatever. If he's talking in your face, if he's, if you have spreading his aerosols, he's spreading his drops, then you will get infected.
Murad, this is Daryl. I can comment on that too. That when I think about the heat, I think about the concern with fitness as well. And so I think if we, especially in the U.S. right now, we're getting into June, July, and August, which are some of the hottest months that we have, especially in the state of Florida. And so the concern is, normally we're doing preseason during a cooler time, and now we're doing preseason during a very hot time. And so when I think about the heat, I think about heat illness and things like that, and how our players are dealing with heat exhaustion and the risk of heat stroke. So I think the heat, as Jens kind of talked about, I don't know necessarily if it increases the infectability of the virus, but it definitely does concern me in terms of the ability for our athletes to stay healthy.
Great. Thank you, Daryl, for this precisions. And maybe Dr. Mustafa also is the same problem in the United Arab Emirates.
Exactly, doctor. It's basically it's more concern here than other place, I think, because the temperatures exceed sometimes plus 50 Celsius, which is plus 110 Fahrenheit actually. So and plus the humidity, which is, I think, it's worsening the dehydration on the player, and we know from COVID basically that it will affect basically the respiratory system mainly, and so I guess that we need really to be careful actually in this season. I know that my colleagues from Orlando has mentioned that Orlando is also, this time is really it's probably hitting hundreds in a couple of weeks maybe. So it is an issue actually everywhere, but in the Gulf area mainly. It is a huge issue, and we had this huge discussion in the last couple of years actually, to try to start probably our league in September, because in September the temperatures gets like plus 40, So by this, there's so many discussion going on, and we try to do everything possible actually to try to find solution. Unfortunately, it's the weather. You cannot control the environment, So our advice was in the summer actually to train indoors, because there is an air condition and you can monitor the environment, and you will have, as my colleagues in Germany and Orlando said, is that the heat loss would be definitely less actually. So, and the injuries definitely will be less too. So I don't have an answer of that, but it's a pretty challenging.
Can I make an appointment related to his head problems?
Go ahead.
Yes. One of the ways of the spreading is, of course, is through the droplets of the respiratory tract. But when we were doing the consensus for the Rugby Federation, we thought about sweating. Of course, the virus doesn't go through the sweating, but if you stay near one person who is spreading, the virus goes to the sweat of the companions around. So the sweat is a vehicle during the time he's playing with the others. So we are touching, we are jumping near the others. So we are sweating also more in summer, and this is one of the ideas that we have to take into account. We cannot play with subjects who are spreading. This is the most important.
Thank you. We received several questions from our friends of the Asian Football Confederation. We start by the first one. Is there any research ongoing on injury on post-COVID resumption of league? Shall I repeat again the question? Is there any research ongoing on injury on post-COVID-19 resumption of?
Not for my knowledge. All the people is researching. We are researching for ourselves what is happening in the different leagues, in the media. And our colleagues like you, we are sharing our experience. But maybe is anything ongoing, but not in my knowledge.
Yes.
Murat, this is Daryl. It's been interesting. The National Women's Soccer League, I've been involved in their medical task force, and there's been several player phone calls with especially the women in the league in the United States, and that's been a significant concern and a reason why some of the women have chosen maybe not to play. And so that risk of injury. So I think it's important for us to evaluate, as all these leagues return to play, what the injury risk is and identify kind of, what the effects have been in terms of what we're doing, not only with the COVID positivity, but also and illness related to that, but also the injury risk.
Great. Xavi, perspective. No.
Sorry, say again, Murat, please.
Do you have any idea about this question? No, I don't think
I haven't heard you very well, sorry.
No, I mean, do you know that are there any studies? No. Studies? No.
No. As far I know, as Luis said, I haven't found anything. Actually, there is a guy offering some news about Bundesliga performance stats and injuries, which is publishing in a blog. But what the data I have are from not peer-reviewed journals or from people that is reviewing the games and collecting data and publishing them, but without any other filter.
Great. So the second question is, how many times the player should undergo PCR tests and challenges in terms of local health guidelines, supplies, and finances? Yes. Difficult answer, right?
No, it's not that difficult because what I said at the beginning of my speech is we cannot guarantee 100% safe player, but we try. Therefore, we are doing it twice a week. This is what we are doing now, and it seems to work that we are testing these players twice a week. And the finances, of course, these are always the local guidelines. What I said, you always have to deal with your local health authorities. If they think twice a week is not enough, we should do it 4 times a week, whatever. You have to find a compromise, and you have to find a solution. In Germany, we're doing it twice a week, and it works. So this is only, but this is not the law. You have to do it twice a week. It is always, you have to talk to your local health authorities, what is their opinion about it. We do it twice a week in Germany, it works. Financial problems, like clubs have to pay it so far, and these are the costs in Germany. Every club tests about 40 persons twice a week, so 80 persons. And then it's also, of course, it's a lot of money in Germany. It's about 18,000 euros we are talking about. And the professional clubs say they are paying it themselves. At the end, of course, something you have to do. It's part of the whole protocol. You have to do it.
Dr. Mustafa, would you like to add something?
Well, I totally agree actually with you, Hans. It is, it is illegal. We are legally bound to do that. We have to notify the cases because this infection doesn't know any skin color or any border or anything. So we have to go actually with the authorities and test. And the more tests that we do, the better actually, because then in that case we can detect the patients and we can isolate them. And we can take care of the surroundings too. So I think testing is really important. I have one question, if you allow me, Dr. Murad,
go ahead, please.
For Dr. Franklin Drobny, from the head of medical service in Sohans, Greenland. I think that he went through a marvelous experience because the virus actually started in China, So I wanted to know what is the impact was actually in his club and from his experience and from the sport community in China actually. So if you don't mind that he can elaborate on that, please, because I think it was a shock that the first people who have suffered that.
Thank you for the question. Well, our experience is really interesting. I was talking with our friends that on Monday we began the pre-season by the 4th time this year. We had to begin in February, but in January it was the beginning of the infection, the pandemic. We went to Arab Emirates, so we stayed in your country very well, and we stayed there for almost 15 days. Then we had vacations. We went to our countries and we turned back to Emirates. We stayed another time then in Abu Dhabi. So we were, what is the English word? We were escaping of the epidemic. So we were training. So fortunately we didn't have any injuries by that moment. But after we turned back to Shanghai, that was at the end of March, we had a quarantine of 15 days. Almost all of the teams of China were doing the same, going to Emirates or going to Spain or even France, etc. So we turned back when the epidemic in China went down. So at this moment in Shanghai there is no new cases. Most of the parts in China there are no new cases. So we are training very much. Even we are doing friendly games. But we are viewing that we have no injuries on training sessions. We have had 4 muscle injuries, severe muscle injuries. We are expecting begin the competition because we will not begin the competition till the middle of July. So don't have a start timing. It's also a problem for because it's training, and what training for what. So related to the question about the pandemic, we are really safe. We are here training. We are going outside to the homes. We are living in really maybe in a big, large bubble in China that we are clean at this moment. So we don't have no cases. We expect so. And even in Europe, or I don't know in your countries, but in Europe they are beginning the competition without concentrations, quarantine elements of the subjects. We have here the healthy status that we are without infections, no infections.
Thank you, Doug. All the best.
Thank you so much. The last question from the Asian Football Confederation. What is the protocol for the positive cases, positive COVID players self-isolation or whole team isolation?
So I can give you the answer on this. What is the German concept? The German concept is, first of all, of course, if we have one positive, he will be in quarantine for 14 days. Only, let's say, if he is symptom free. If he is just positive and has no symptoms, then he stays for 14 days in quarantine, in isolation. If he is sick, then we will do it that he has to stay in quarantine 5 days after he is healthy again. So after the last symptoms, he has to stay another 5 days in quarantine in isolation before he's coming back. And of course, when the protocol, when you look what we do in Germany, that's what I said, because the decision who is in isolation is a decision of the local health authorities. It's not a decision of the club. So this is why we have to, in Germany we have, with the local health authorities, they have risk groups. Risk group number 1 is the one who is living together with you. So it's a high risk that he is also get infected. The football players are a risk group 2, so we managed to put them in risk group 2. So these are people who had contact to someone who is positive, but the contact is not very long, it's very close, so they don't spend so much time together. That's why I said, that's why everything is done, that they travel with different buses, that they not using the same dressing rooms all the times, that they are not sitting together with dinner or lunch. And what also was shown in one presentation, that the contact times during the matches is very short, so that we can convince the local health authorities this positive player only had a very few contacts, and these contacts belong to the risk group 2. So these players who had, or the physiotherapist who was together with him, will be tested, but all of them will be tested twice a week. So if we have a positive case, the player will be in isolation, and normally if there was not a very close contact to any other person from the club, they are not in isolation, but they will be tested directly, and we have the result within 24 hours.
Great. What's about other experience in the States, for example, Daryl?
Yes, so in Major League Soccer, actually, we're still undergoing the process of a phased return to play, and so it's being discussed about how to deal with the positives. From a positive perspective, considerations are if you're symptomatic and asymptomatic, and whether we follow more of a time-based approach or a testing-based approach. And so that's overall what kind of is being discussed right now. And then the positive contacts, right, which is one of the biggest concerns, is contact tracing and such, and how do you approach that if somebody tests positive and all the contacts around them? Well, if you go by the Center of Disease Control guidelines, then high-risk exposures would be quarantined for a 14-day period. And so in the United States right now, we're trying to determine how we deal with that, because if you have a game that's played with everybody in the box, certainly everybody's a high-risk exposure potentially, and that could shut down several teams. So trying to figure out if there's a testing approach that everybody's comfortable with to deal with the possible contacts of people that have been positive. So I think that's for us has not been rolled out yet, and we haven't lived that yet. So obviously our colleagues in Germany have, so I'd be interested to hear how they're dealing with the positive contacts as well. So I answered a question and then asked a question.
Yeah. Yeah, correct. Xavi? Xavi, are you there?
Hi, sorry, I was switching on the microphone. Well, we follow a very similar protocol than our German colleague has described. So we are testing our players very often, keeping them isolated. Actually, we did the second. Now I'm talking about the second senior team. We did the second round of tests this Wednesday, just previous to start. Today is going to be the first training session with the small groups, and then again repeat the process. And every time we test them and they are negative, we are more quiet to make bigger groups. But I think is one of the challenges we need to deal with this is to make them understand that even being tested and test negative, they have to keep respecting rules. Distances, washing your hands, the more easy things to do are the more complicated, because people relax and they think, why can I not hug my friend or my colleague? Both we are tested negative. So this is a difficult part. But that's why we are all day insisting and remembering and refreshing the concepts.
Yeah. So the last question is from a famous coach. It's always technical more than medical. He talks about the risks of playing congested games, congested schedule, the perpetual dilemma, load versus recovery, and injury prevention.
This is not my topic. I cannot answer the questions. I only can say what FIFA did, because FIFA allowed, because now we have a lot of matches in a row and the recovery is quite low for the players. So FIFA allowed now that 5 substitutions per match can be done.
Good. Xavi?
Yeah.
Luis?
I think that to control loads is a really important point right now in this process of restart activity after this long break. But at the end, when you have to face the competition schedule that you have, there is no possibility to change that. So the control load is quite difficult at some point. Probably we need to think about how there is a balanced process between put our players fit and prepare to compete and control loads, because if you train a lot, there is no time to recover between matches and training sessions. That's going to be a really, really challenging thing to do. We will need to focus on recovery. Recovery measures are always important, but in this case, we are sending a lot of messages to our players about how to eat, how to rehydrate, all the recovery measures that, for example, cold bath and these things that they have to do at home, which make things even more complicated. Be very alert about red flags, medical red flags, when we see that the team is showing signs of overtraining, or that they are not tolerating well the loads. So communicate with sports science, with the coach, and then just assume the situation. We have to, as I said in my talk, I think it's a unknown territory, and it's going to be a challenge, and try to drive through it with the knowledge we have the best we can.
Yes. In my opinion, there are some important key points to take into account, and most of them have been talked during the different lectures. One of the key points is progression, to be as progressive as possible, but sometimes we have not enough time to do that. Maybe German and Spanish league have not enough time. Chinese league is totally different than French league because we have time we have fight to have time to train progressively. Another key point for me is that Xavi has said that there is no load like the games, and this doesn't matter how many you train, but at the end is the game the most risk situation, and is the game the real load, and we need to be prepared for that, but it's difficult to manage that. And finally, I want to point out to take advantage of this bizarre, strange situation of COVID, because not only doctors but also sports scientists have more heated, and they have take more important role in this moment, because the sports community is worried not only by the infection, but also by the injuries, but also by how managing the load. And I think at the end we can have some advantages from this. And for example, this conference that you have organized, Murad, is a good example. We are sharing from all the points of the globe together. We are sharing our experience. We are sharing our worries about this situation, and we are learning a lot from the others. And this is the advantages that we need to take after this situation.
Thank you so much, Luis. Darren, would you like to add something before closing?
Sorry.
Darren, do you have something to add? Because now we are getting a lot of questions from YouTube. Go ahead, Darren, please. We cannot hear you properly. You're on mute. He's on mute.
Just unmute his own mic.
Unmute. Darren, unmute your mic, please, Darren. No.
Do you want me to add something here? Is it okay?
Yes, Dr. Mustafa, please.
Yeah. Well, actually, I think that the world actually is looking into us as a football professional nowadays. All the focus is basically because the football professional is a huge. So I think that we need to play it very carefully, as Dr. Heinz said, is that we need to, do more awareness about distancing, testing, information, very important actually for not only for the community, for our players, because the players are an example, and people, everybody, it's an example for a youngster. mainly, because they look to them as an example. So they have to be very well aware about that, and I'm sure they are. So, social distancing, making sure that they are doing enough training, and, so they don't lose their post actually, and, someone else is going to take their post. So I think that the focus is huge in the football nowadays, and everybody is looking into the experience of Germany very carefully, and I hope that, I'm sure that the Germans are very good in this, definitely, and the European are, the Spanish leagues and the others are going after them actually shortly. So everybody's learning from each other, and that's the good thing about that. And again, thank you very much, Dr. Murad, and all of our colleagues that will learn a lot from them.
Thank you, Dr. Mustafa. Go ahead, Darren, please. Go ahead.
Yeah, sorry about that. I couldn't get off mute, but I think the big picture here is that our players, our staffs, everybody have to understand this is a shared responsibility. This isn't just the doctors. This isn't just the owners. This isn't just the team management per se. This is players that have to share responsibility about their actions are gonna affect the success that all of us have. I think overall, just like everybody else, physicians, hospitals, we're trying to return people to work, and part of who we're trying to return to work are athletes. And so with that responsibility, our medical staffs and everybody on this call are trying to do our best to do it as responsibly as we can and try to provide as protective of an environment as we can. But certainly we can't necessarily guarantee that nobody's going to test positive. We can't guarantee that nobody's going to get injured. All we can do is do the best we can and make sure that the players are part of that process and share that responsibility in making this hopefully as successful as we can.
Thank you, Darren. So if you allow me, all of you, to say at the end that everything related to COVID-19 has always been unusual and prone to last minute surprises. And today our webinar was no exception to that rule, and the problem a minute before, just 1 minute before we start. So fortunately, and thanks to all the efforts of our friends in the Football Association, Dr. Muhammad, led by Dr. Mustafa, Dr. Muhammad, and all the IT people, we came back to live at the end of that session. We had a lot of interested questions from YouTube, so from our friends around the world. I would like to thank, and I would like to say them, if they don't mind, we can go to another second part because it's very interesting what we are saying, and we can never be satisfied. And if during our next part we can have more questions and we can be more accurate, and at the end, I would like to thank our colleagues, or our colleagues led by Jans. Jans, really, you did great today. We are proud that you are our leader today. I would like to thank everybody, and please, Jans, would you like to close?
Yes, I just can say it was a big honor to be with you, and I learned a lot from all of your speeches, what you talked about. And of course, it's a webinar. I wait for the time that I can see in real life. But this is, I think, everybody of us has done it now, has sit in front of a computer so many times that he did not before. But I hope this time will change and that I can see you in real life again. But I think it was a really very, very, very nice experience we shared, and we could show also that this is possible to share the experience we made, and that's all about it.
Hopefully the tight schedule of all colleagues will allow us to go for a second part, hopefully.
We will see. Thank you so much. Thank you so much for everyone.
Just stay online, please, 1 second, because I think we have a message from our friends from UAE Football Association. Go ahead, please, Dr. Mustafa.
Yes, honestly, I'm again very thrilled to know you all actually and learn from your experience. And again, football is probably the only thing that bring people together actually, regardless of anything else. So we have to promote that. The other thing, we would love actually to have you one day in UAE when we are doing a huge conference probably in the next year. We're planning to do that in coming 2 years. So we'll be very happy to have you here. And again, thank you very much for everything, Dr. Murad and Dr. Hines and our colleagues from States and Spain and France. I'm sorry, I'm very bad in remembering names actually. I'm getting old, I think. So, but anyway, and hopefully things will be, we pray that things will be stable in the United States, from our colleagues that in Florida. So hope we have to pray for peace. Once we have peace, that's the most important.
Thank you so much. Thank you, everybody.
Thank you.
Thank you.
Bye-bye. See you very soon. See you next time. Bye-bye. Bye-bye.
Thank you. خلاص.
مهندس محمد عامل كومبي